Why does blood pressure start creeping up when we're in our 40s? There's a few different things that are going on here that explain why this happens, and none of them have to do with your willpower. First, your estrogen levels start to decline if you're a woman in perimenopause. That's going to lead to stiffer blood vessels. That is going to lead to higher blood pressure levels overall, as well as an increase in the pulse pressure. So the difference between your top number, systolic, and your bottom number, diastolic, direct reflection of how stiff your blood vessels are. The second thing that happens is that cortisol patterns shift, and not in a favorable way. Your overall baseline cortisol level tends to increase throughout the day rather than starting out very high and then declining over the day as you see in earlier life. That's going to lead to different hormonal cascades that are going to ultimately increase your sympathetic tone, which is going to lead to, you guessed it, higher blood pressure. The next thing that happens is that we are becoming more insulin resistant as we age. That is something that we can counteract through lifestyle and sometimes pharmacological measures. However, if you're not doing things to counteract the natural tendency towards insulin resistance, that's going to affect your hormones. So it's going to affect the way that your kidneys process salt and fluid, which is going to lead to increased blood pressure. It's also going to increase your systemic inflammation, which again is going to lead to increased blood pressure. It's going to lead to less nitric oxide production as a result, which is going to lead to increased blood pressure. So there are so many factors that are at play when we start to develop an elevated blood pressure in our 40s or 50s. And there's not one simple solution that's going to decrease the blood pressure. There is a combination of strategies that we can use to mitigate these effects, but they need to be taken with a bigger picture view and not just telling someone to exercise more or just eat less, because that's not the comprehensive solution to this. Sometimes exercising more and eating less can actually stress our bodies out a little bit more. So there are definitely nuances to this, and it's important to have a doctor who understands the fuller picture of what's happening in perimenopause and is able to develop a comprehensive, targeted lifestyle first solution to address it.